Now, the Ministry of Health has announced the suspension of the training of nurse assistants, that's clinical nurse assistants and nursing assistants, preventive as well, effective 2019 and 2020 academic year. A letter dated June 29, 2018 to all deans, heads and principals at nursing and midwifery training institutions said the suspension is aimed at strengthening the degree and diploma awarding programs in nursing and midwifery to improve the standard of practicing of nursery and midwifery. So what does the suspension of these programs mean to healthcare delivery in the country? And is it true that there are enough nurses, enough of the nurse assistants in the country? We can get more details on that from President of the Ghana Registered Nurses and Midwifery Council, Dr. Kweku Asante-Krobia. Hello, sir. Hello, Doc. Can you hear me?
Hello.
Yes, Dr. Asante-Krobia, thank you very much for your time this afternoon. I'm sure that you've seen the letter.
Hello.
Yes, sir. Can you hear me? Dr. Krobia Asante.
Yeah.
Hello, Doc.
Yeah.
Can you hear me?
Yes.
Right. I'm asking if you've seen the letter suspending the training of nursing assistants. Seems I'm having a challenge hearing Dr. Asante-Krobia there. He's the president of the Nursing and Midwifery Association there. Let me try it one last time. Sir, can you hear me? I cannot hear him.
I can hear you, Ben, so let's do
What
Hello?
did you... Can you hear me?
Yes, I can hear you.
Very well. Have you seen the letter, sir?
Yes, I have seen the letter.
Is that a good thing or a bad thing?
That's a good thing, I can say.
Why is it a good thing?
Right. The intent is to cut down the numbers of the auxiliary nurses that are being, that is the nurse assistant. Because the international standard for to measure the quantity and quality of the output of nurses and midwives contributing to total health must be 60% of the professionals and 40% of the nurse assistants. The converse is true in the situation for Ghana, but I'm talking to you about the international standard. Even at this time, because of the global burden of disease and how the healthcare issues and problems.
Now, Doc, sorry to interrupt, Doc, but I'm just really trying to find out how refusal or how suspension of training people who can help in the health sector. The health sector we know appears, of course, to need a lot of hands. So why do you stop training people who can help deliver health service to Ghanaians? And how even is that a good thing?
Yeah, what is going to happen is that as we de-emphasize the training of the nurse assistants, we are going to increase the training of the professionals. That is the diploma prepared nurses and the degree prepared nurses. So we're not going to lose anything.
Okay. So the reason basically for this is to focus...
To cut down the numbers that are being sent out here from that is the nurse assistant cohort. And I was explaining to you earlier on that it must be the case that we have 50% of the professional nurses and 40% of the nurse assistants. The converse is true for the situation we have on hand at the moment for Ghana, and we can continue like that.
All right. Well, hopefully this gives us the sort of returns that we want. Dr. Asante-Krobia, thank you so much for your time this afternoon.
Welcome.
Dr. Asante-Krobia is president of the Ghana Nurses and Midwifery Association.